The tongue is a speech articulator that's composed primarily of muscle. In this case, the tongue has left and right halves of muscle that are divided by the median fibrous septum. Looking at the tongue from the top, you can see that division in a channel that runs from the tip of the tongue to the tongue dorsum called the median sulcus. The posterior third of the tongue is covered in small bumps called papillae that contain our taste buds. The posterior third is also divided from the front along the coronal plane by a channel called the terminal sulcus, which isn't particularly visible in any of your images in the book. This image from a classic anatomy textbook shows some of that texture and division of the tongue in a little bit more detail. In this case, this would be a drawing of a tongue that's been cut out of a body and looked at separately from above. Looking at the tongue from below, one landmark is the lingual frenulum, a band of tissue that runs from inside the lower mandible and connects to the underside of the tongue. In rare cases, it can be short and thick, inhibiting full raising of the tongue and causing problems with speech production, so that can be cut surgically to solve that problem. Also beneath the tongue are sublingual folds, bands of tissue that sit at the base of the tongue, where a lot of the salivary glands and ducts for the submandibular and sublingual salivary glands are found. The tongue is composed primarily of muscle. There are a set of intrinsic muscles contained completely within the tongue that make up most of the tongue body. These are the superior longitudinal muscle, the inferior longitudinal muscle, the transverse muscles, and the vertical muscles. There are also a set of extrinsic muscles that connect to the tongue from outside sources and to some extent make up the remainder of the tongue body. These are the genioglossus, the hyoglossus, the styloglossus, and the paladoglossus, which will also be discussed in talking about velum muscles. Here we have two different views of the intrinsic tongue muscles. The image in the upper right is a frontal or coronal section cut through the tongue, separating the front part of the tongue away from the back part of the tongue. The lower view is a lateral view of the tongue, such as in a mid-sagittal section, where you make a sagittal plane through the center of the head, separating the left and right halves from one another. The intrinsic tongue muscles make up the majority of the upper surface of the tongue, to the extent that the tongue looks a little bit like a mushroom, where it's got a thinner base that widens out at the surface of the tongue. These intrinsic muscles fill up much of that upper surface of the tongue. Intrinsic tongue muscles control the shape of the tongue or the posture of the tongue and are involved more in consonant articulations that require minor details of tongue position and posture rather than vowel articulations, which tend to be a little bit broader movements of the overall tongue. The superior longitudinal muscle runs the length of the tongue and comprises the upper surface of the tongue. It originates from the median fibrous septum within the tongue, the hyoid bone, and a fibrous layer at the root of the tongue that's just behind the epiglottis, to fan upward and outward to insert into the tongue tip and the lateral part of the tongue blade. When this superior surface muscle is contracted, it will curl the tongue tip up or change the shape of the tongue blade into more of a spoon-like shape or cup-like shape. The inferior longitudinal muscles run the length of the tongue and comprise the lower sides of the superior tongue. They originate at the hyoid bone and root of the tongue and insert into the tongue tip and lateral blade inferior to the superior longitudinal muscle. This muscle can be used to curl the tongue tip down to keep the tongue tip from contacting surfaces during some tongue articulations. If contracted together with the superior longitudinal muscle, it can be used to pull the tongue tip back, or if both the inferior and superior are contracted lightly, they can stiffen the tongue tip to allow the tongue tip to be used for a variety of articulations. The transverse muscles originate at the median fibrous septum within the center line of the tongue over the entire length of the tongue and course laterally to insert into the sides of the tongue. So when contracted, the transverse muscle is going to compress the tongue from the sides which usually causes the tongue to bunch up or bulge in the center. If you think of the tongue kind of like a bag of muscle, if you squeeze in on one part of it, other parts are going to bulge out because the mass of the tongue has to go somewhere. The vertical muscles originate at the base of the tongue and insert into the surface of the tongue. Contraction of the vertical muscles is going to pull the tongue down, which will cause the tongue to bunch out or bulge laterally out to the sides. Because again, if you flatten out that tongue bag of muscle, the mass has to go somewhere. If you're constraining it vertically, then it's going to stick out horizontally. Within the structure of the tongue, the fibers of the transverse and vertical muscles of the tongue interweave with one another within the tongue body, so they're not separate packages of muscle that course in different directions, but they make kind of a crosswork pattern of muscle fibers inside of the tongue. If we start to think about how these tongue muscles can be used in articulations for speech, we have some extreme cases, like a low vowel like ah, where the goal is to open the mouth up as much as possible, flatten the tongue out as much as possible to create as much room in the oral cavity as possible. The muscle that's going to do that for us the most is going to be the vertical muscle fibers, pulling down on the upper surface of the tongue, flattening the tongue out. Superior, longitudinal, and transverse would both help elevate other parts of the tongue. Inferior longitudinal would at least pull down on the tongue tip, so that would help a little bit, but for something where the entire tongue body is going to be lowered, like an ah vowel, vertical tongue muscles are your best answer. For some of our consonants, like the t and the l sound, the tongue tip is raised to touch the alveolar ridge. The muscle that's going to do that tongue tip raising is the superior longitudinal muscle. That will be an important component of the tongue tip raising part of the t or the l articulation. Other muscles may be involved in other aspects of the articulations of these speech sounds, but at least for the tongue tip raising part, superior longitudinal is your best answer. Looking now at the extrinsic tongue muscles that come from structures outside of the tongue to connect to the tongue. These muscles are found primarily in the body of the inferior tongue, making up the base of the tongue, the support structure for the intrinsic tongue muscles. Generally speaking, extrinsic tongue muscles will control the tongue position or location in the oral cavity, whether forward or backward, lower or higher. These are especially important for vowel articulations, where the primary goal is to put the mass of the tongue in a particular place to create a particular pattern of resonance for the vowel sound. These muscles may have a supporting role in consonant articulation. If you want to do something like raise the tongue tip up to touch something, it can be helpful for the other tongue muscles to hike the tongue up overall to make that tongue tip raising easier. The genioglossus muscle is our most complicated extrinsic tongue muscle. It comes from the inner mandible near the symphysis at the front of the mandible, where the two halves of the mandible bone fuse together in development. This muscle fans out and inserts into the surface of the tongue, joining with the vertical muscle fibers all along the entire length of the tongue, and also the most inferior and posterior fibers of the genioglossus will connect to the hyoid bone. So given the full fan of genioglossus muscle fibers, it can have a number of different effects on the tongue. The anterior fibers will come from the inside of the jaw up toward the tongue tip and blade, and they will help pull the tongue body downward in the front. The posterior-most fibers are going to course basically straight backward into the root of the tongue, and so they would help pull the tongue body forward. Middle fibers in between the anterior and posterior would course kind of angularly up into the tongue dorsum, and so they will help pull the tongue body downward and forward. So depending on which parts of the genioglossus get contracted, can actually do quite a few different things in speech articulation. The hyoglossus muscle is a little more straightforward, comes from the lateral part of the body of the hyoid bone and the greater horns, the greater cornu of the hyoid bone. It inserts into the sides of the tongue between the inferior longitudinal muscles and the styloglossus muscle, which will be talked about in a minute. This will pull the sides of the tongue downward and backward. The styloglossus muscle comes from the styloid process of the temporal bone just behind the ear. It inserts into the inferior sides of the tongue, mixing with inferior longitudinal and hyoglossus muscle fibers. The styloglossus muscle will support pulling the tongue body upward and backward, along with the palatoglossus muscle that has a similar course. The palatoglossus muscle underlies the anterior faucial pillars in the oral cavity, comes from the palatal aponeurosis within the soft palate within the velum, will be talked about again in the velum muscles. It inserts into the sides of the posterior tongue, so then depending on other muscles being used synergistically, the palatoglossus can either lower the soft palate or raise the tongue upward and backward, or bring the soft palate and the posterior part of the tongue dorsum, together as part of speech articulation, or in some cases in the chewing and swallowing that we're going to talk about later as well. Here's a slightly different drawing of some of these extrinsic tongue muscles that show some of the muscle fibers and connections a little bit better, like the fanning of muscle fibers for the genioglossus. This image also provides a little bit more context for some of these extrinsic tongue muscles, showing the hyoid bone and some of the hyoid, infrahyoid muscle connections for that would act as synergists to the use of the hyoglossus, for example, to lower the tongue. This also shows some of these tongue muscles in the context of some of the other pharyngeal muscles, the pharyngeal constrictors that we'll talk about when we talk about pharyngeal muscles. So to connect up some of these extrinsic articulations, or extrinsic muscles, I should say, with articulations for speech, if we have a vowel like A, where the tongue body gets pulled forward, the muscle that is probably active in creating this articulation would be the genioglossus muscle, the muscle that has fibers coming from the anterior part of the jaw and inserting into the rest of the tongue body. Hyoglossus, styloglossus, palatoglossus muscles are all connections from the tongue to the posterior part of the head, and so would be involved more in backing the tongue. A slightly more complicated and challenging question related to extrinsic muscle activities. There are languages other than English that have fricative sounds produced in the pharynx by pulling the tongue root toward the posterior pharyngeal wall. If I was going to think about my extrinsic tongue muscle actions and which one would help bring the tongue root toward the posterior pharyngeal wall the most, I think your best choice is the hyoglossus muscle. Hyoglossus pulls downward and backward on the tongue. So in addition to helping pull the tongue backward directly, pulling on the surface of the tongue is also going to squish the tongue body down, which is going to cause the tongue root to bulge out. So as we pull the tongue body downward, that tongue structure has to go somewhere. If we've capped it from above by a hyoglossus action, then it's going to end up sticking out in the back.